Good afternoon, Darwin Newman. Let's begin the warm-up session. Why did you choose OT?
It is my long-term ambition to work as a registered nurse in any English-speaking country, such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence, I choose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals, therefore, I believe I could perform well in this test.
What are the current trends in your profession?
Nursing is a dynamic profession, and changes happen daily. Nowadays, technology plays a vital role in my profession. For instance, paper records that we used in the past have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in present days, a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families.
What do you like most about your profession?
What I like most about my profession as a nurse is the opportunity to make a meaningful difference in people's lives every day. Nursing allows me to provide compassionate care and support to patients during some of their most vulnerable moments. The ability to offer comfort, alleviate pain, and promote healing is incredibly rewarding. Additionally, nursing is a dynamic and ever-evolving field that challenges me to learn and grow. I appreciate the collaborative nature of healthcare, working alongside dedicated professionals to deliver the best possible care. The relationships I build with patients and their families are deeply fulfilling, and knowing that I have positively impacted someone's health and well-being is what drives my passion for nursing.
Do you have a role model?
Yes, I do. My role model is my mother. I follow many of the things that my mother does. It is from my mother that I learned the basics of kind behavior, decision-making, organizing skills, a polite and humble manner, helping and sharing mentality. The care and respect she gives to everyone makes me wonder sometimes. She is a perfect example of womanhood. I believe a nurse should possess all these qualities. She is my superhero.
Your preparation time is over. Please start your OET Speaking roleplay.
Good morning, Mihiraa. I'm your nurse Darwin here. It's good to see you again. Could you please confirm the reason for your visit?
Nurse, I am here because of chest pain. I am worried that it could be deep vein thrombosis or a pulmonary embolism.
Oh, I'm so sorry to hear that. Well, Mihiraa, could you tell me a little about how your recovery has been going overall since the surgery?
In general, the recovery from the appendectomy seemed to be going okay initially. You know, the wound is healing, and the pain from the surgery itself is much better now. But then this chest pain started a couple of days ago, and it's just made me quite anxious.
I understand your anxiety, Mihiraa. Chest pain is certainly something we need to look into, especially after surgery. I can see you're concerned about DVT or PE, which are deep vein thrombosis and pulmonary embolism. That's understandable, as these are potential post-operative complications. To help me understand what's happening, can you tell me a bit more about your symptoms?
Sure, the pain is mostly in the middle of my chest. It's not really sharp, more of a dull ache. Sometimes it feels a bit tight. I haven't really noticed any swelling in my legs, and they don't feel particularly warm or red. I have been a little bit breathless at times, especially when I walk around, but I thought that was just because I've been less active since the surgery. I do feel a bit lightheaded sometimes when I stand up quickly too.
Alright, are there any risk factors for you?
No, nurse, I'm not a vulnerable person. I've never had any blood clots before, and no, I don't smoke.
Thank you for explaining that so clearly, Mihiraa. It sounds like you're describing post-surgical discomfort, which is actually quite common. Sometimes, chest pain after surgery can be due to muscle strain from coughing or just from the way you've been lying in bed recovering. It could also be related to a bit of anxiety you're feeling, which is perfectly normal. However, it's absolutely right to be aware of the signs of DVT and PE. Just so you are clear, the symptoms we really worry about with DVT or PE are sudden, severe chest pain that comes on very quickly or significant difficulty breathing that is new and getting worse. If you experience anything like that, it's important to seek immediate medical attention. Please be reassured, though, DVT and PE after an appendectomy are relatively rare, but it's certainly wise to be informed and know what to look out for.
Okay, that's a bit reassuring. So, what can I do to prevent DVT or PE then, just in case?
That's a very proactive question, Mihiraa, and there are definitely things you can do. The main thing to focus on is keeping your circulation moving. Firstly, early mobilization is key. This means trying to move around as much as you comfortably can, even if it's just short walks around the house. Getting up and moving helps to get your blood flowing and reduces the risk of clots forming. Secondly, hydration is important. Make sure you're drinking plenty of fluids throughout the day. Water is ideal. Staying well hydrated helps to keep your blood flowing smoothly. Thirdly, there are simple leg exercises you can do, even while you're sitting or lying down. Things like ankle pumps, just pointing your toes up and down and rotating your ankles. Doing these exercises regularly helps to keep the blood moving in your legs. Finally, use the prescribed compression stockings as instructed. Do you have any other concerns?
Nurse, I was wondering what could be the reason for my chest pain then? Is it something normal?
Your question is valid. Mihiraa, let me explain about the chest discomfort you're experiencing. It's also worth knowing that post-operative chest pain can have other causes that are less serious. For example, since you had laparoscopic surgery, we use gas to inflate your abdomen, and that gas can sometimes irritate your diaphragm and cause referred pain in your chest. It can also just be muscular tension from being in a slightly different position during surgery or afterward. So, there are several reasons why you might have some chest discomforts that aren't related to DVT or PE. Apart from the chest pain, is there anything else concerning you about your recovery at the moment? Any other worries or questions?
No, not really. Just the chest pain was the main thing playing on my mind. The wound is healing well, I think.
That's good to hear about your wound. Mihiraa, the most important thing now is to monitor how you are feeling. Please do get in touch with us again, or your doctor, immediately if your chest pain gets significantly worse, if it becomes very sharp or sudden, or if you develop any new or worsening shortness of breath or any swelling or pain in your legs. These would be signs that we would need to investigate further and possibly refer you for more assessment, perhaps back to the hospital. But based on what you've described today and how you are presenting, it doesn't sound like you are currently experiencing DVT or PE, which is very reassuring.
Okay, I understand. I will definitely keep an eye on things and come back if anything changes or gets worse.
That's excellent, Mihiraa. So, to be on the safe side and to reassure you further, how would you feel about scheduling a quick follow-up checkup in about a week just to see how you're progressing and to check in on this chest pain again? Would you be happy for us to arrange that for you?
Yes, that would be great, thank you. It would put my mind at rest to have another checkup.
Wonderful. Then I will arrange that for you right away. In the meantime, remember those preventative measures we discussed: keep moving, stay hydrated, and do those leg exercises. And please don't hesitate to contact us sooner if you have any new concerns or if your symptoms worsen.
Thank you so much for your help. I feel much better now and know what to do.
You're very welcome, Mihiraa. Take care, and we'll see you again soon.